and welcome to my YouTube channel. My name is Joanna the Nurse, and today I just kind of want to give you a descriptive overview of, this is me, I drew myself, of what I would recommend for someone that came in with certain concerns, okay, that I have had in the past, personally, that I have addressed. So the first thing first is one thing I did for my face was I did a little bit of Botox in the masseter. So the masseter is right here, and I'm going to be using a red pen, red thingamabob, to show you guys. And what I did is I just injected myself with a little bit of Botox in the masseter. What that does is it shrinks the face actually, and so it causes a little bit of atrophy to the muscle, and it actually makes the face look a little bit slimmer. So what I'm gonna do, so after the Botox takes effect, in typically about a month, what I'm gonna do is that I'm gonna show how it actually does slim the face. So you can see how it slimmed the face, okay? So that was actually the first ever injectable that I did, and I loved it. So this is if you're looking to slim your face. The next thing I did for my lips was I did a little bit of lip filler, and I did a total of 3 syringes to make my lips a little bit bigger, a little bit more defined, a little bit juicier, and more kissable. And so let me show you guys how my lips became bigger as well. So now they look a little bit, okay, that looks really big, and that looks really ugly, but a little bit more like that, okay? A little bit smaller, okay? I also like to put a little bit of filler in the tip of my nose, and so what I like to do is that I'm gonna use a Sharpie, and so I just like to do a little bit in the filler, in the tip of my nose right there. So let me show you guys. Okay, so after a little bit of filler in the nose, it can just kind of lift it a little bit like that. Okay, so that is my new little lifted nose. Okay, the next thing I like to do, and I do this about every 4 months, is I do a little bit of Botox. I address my frown right here, and so I inject a little bit right there, and what that does is with my frown, so when I frown my muscles, there are lines that form. So I like to inject, whoa, oh my, hold on. Okay, hold on. Okay, so I like to inject a little bit there, and I also like to inject a little bit on my forehead as well. Sometimes I like to inject a little bit on my crow's feet too, and I could like to give myself a little bit of a lift. So let me just show you guys how that actually helps my whole look. So I'm just going to erase this. I'm going to erase my bangs too, just because it's getting in my way of my drawings. And so after, with a little bit of Botox, what it does is it does kind of give you a little bit of a softer look. Okay, so I like doing that as well. So I like to address my frown and my forehead, and sometimes a little bit on my crow's feet as well, to give me a little bit more of a lift. Let me add those bangs back in. Okay, the next thing I like to add is a little bit of cheek filler. And so wow, it sounds like I like to do a lot to myself, and I do, but so a little bit of cheek filler. And what I typically like to address is a little bit like right here, and I like to adjust my cheeks to just give me a little bit more of that contoured look. And so I typically address it right here. And so I do a little bit of mid-face too. And so that just kind of plumps up my face a little bit, but it also gives me a little bit more of a contoured look. So I'm gonna show you guys how that looks as well. Okay, so, uh-oh, my eyes are going away. Okay, so I'm just gonna, I guess it's kind of hard to show like that. Okay. That's like a little shadow effect. Okay, the last thing I did most recently was I did do a little bit of chin filler, and I also did a little bit of chin dimple Botox. And so what the chin filler did is it gave me slight projection, which I can't show you guys on this image, however. Zoom in. So I did a little chin filler. Okay, but I also did a little bit of chin dimple Botox. So every time I would talk, I would hate it because my chin would look like that. You zoom in. And so what I did was that I did a little bit of chin dimple Botox, and now it just gave me a super smooth chin, which I really, really like. That typically requires just 10 units. And so that is, hold on, let me see. Okay, and then also you have to think, as a whole too, I do a lot of medical grade skincare. skincare. If you want to know my recommendations, I have a YouTube video on my skincare routine. I also do hydrofacials now, which I love. I also do PRP, microneedling, and also I just use a lot of SPF. Perfect. And so right there, that is a quick overview of some non-surgical things that I have done. I hope you guys like my picture and I hope you guys like my presentation. Thank you guys so much for watching. Hi guys, and welcome to my YouTube channel. Again, this is my patient, Joe, and what I'm gonna be doing is I'm gonna give you guys how I would assess his face. He is a 47-year-old male. He has 2 kids, and he lives in Huntington Beach, so he is local, which is great. So this is gonna be his first time ever getting anything done, and he's kind of interested in, hey, like, what should I do? I wanna look a little bit more refreshed. I don't wanna change my face, but I wanna look younger, I wanna look more youthful, and I just wanna feel more fabulous about myself. And Father's Day is coming up, so his wife decided to treat him and his 2 kids. So when he comes in, I'm gonna first assess his face. So you can see that he has these pretty deep set wrinkles right here, and he has some forehead lines as well. And you can see he's not making any movement because he is not real. However, I will tell you that these lines, when you see the lines at rest, Botox can soften it. However, they won't fully take it away, at least not most likely the first time. However, eventually they will hopefully smooth out. So what I would recommend for him is a little bit of Botox here. I would also recommend a little bit of Botox on the crow's feet. You can see he's a very happy guy, and so he does smile a lot. Also, he does tell me that his mom has pretty deep crow's feet, so a lot of times too, like under eye circles, crow's feet, a lot of it does have to do with genetics. It is hereditary, so I would recommend doing a little bit of Botox right here as well. One concern he has too is that his smile lines are on the deeper side. These are also called the nasolabial fold. And I think for men that it is great to do a little bit of filler right here. It gives you an immediate like plumped up look, and I think he's gonna look really good. One other thing I do notice about him is that his lips are a little bit asymmetrical. So my main population for lips does tend to be women. However, I do have a decent amount of men that are interested in lip filler, but a lot of times they don't want to look like a duck, or they don't want to look overdone, or to be honest, they just don't want their best buddies to know that they've had lip filler done. I can tell you when lip filler is done well and conservatively, it looks very natural and it does help with asymmetry. So what we're gonna do is we're gonna kind of smooth it out, give him a little bit more definition, also give him a little bit more symmetry with the lips, because you can see his lips are a little bit asymmetrical. For his smile lines, they are on the deeper side, so I probably recommend about 1 per side to start off with. For this, I would typically recommend anywhere between like 50 units on average, since it is going to be his first time doing it. However, I will warn him, of course, that it is not going to completely take the lines away at rest. However, it's going to prevent it from typically getting worse. Other than that, Joe is pretty good. What's his name? Joe is pretty good. You can also see though too, this was unintentional. However, just looking at his face and doing a facial assessment on him, you could see that his chin is a little bit off center. So a lot of times too, I may recommend a little bit of chin filler, and that is going to give him a little bit more of a symmetrical look on his lower face. So I think Joe would really, really like it. He's also looking for a little bit more of a masculine side profile, so I may recommend also a little bit of jawline filler to give him that, because I think men are great candidates for jawline filler. But other than that, he looks great. I would probably recommend some really good skincare for him to help combat these wrinkles and just overall give his skin a better texture, as texture does change with age. Make sure that he's on a good sunscreen. Make sure that he is on a good skincare regimen, as he is 47, but 47 turning 35, so just kidding. But anyways, and so that is it for Joe. And so let me show you guys how I would inject. So I'm gonna be getting, and obviously, disclaimer, these will obviously not be reused. So right here, this is just 0.7, but what I'm gonna do is that I'm gonna show you guys how I would like, can kind of see the consistency, and this is Restylane Refine, which I actually think is great for men. Okay, and I don't inject like this actually, but You guys can see kind of like the consistency. This lip is a little bit, so I'm gonna try bringing this down a little bit, give him a little bit more definition upwards as well. Okay, and again, you guys, I do not inject like this. However, you guys can at least see the consistency of the filler right there, and then right here. And it's not all gonna be in the border, however, here, we'll just put a little bit there. So this is the consistency. But I would kind of show you guys. So how I do the Botox injections would be a little bit right here, 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 a little bit right here, 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 here. And of course, when you do Botox, you want to assess their movement too, because as the muscles are in a pretty general area, everyone's face is obviously very different. Do a little bit of Botox here on the crow's feet, right here. And that's pretty much it for the Botox. Do the smile lines right here. And so. I'm just gonna be doing his smile lines. A chin filler for him. His asymmetry in the chin, I would focus just a little bit like right here and just kind of do like an overall focus right there. Perfect. And so that is Joe, and so he is done. He is going to follow up with me if he has any questions or anything like that, but also he's probably going to hopefully love his results, and he will be back in about 3 to 4 months.
Do something.
The tip up.